Hi, everybody. This is Dr. Leslie Blevins with Enilda Clinic at enildaclinic.com. Before we get started, I'm going to encourage you to go ahead and hit the subscribe button on YouTube. And if you're watching this at enildaclinic.com, sign up to get these videos in your email. You can do it at the learning page or the resource library page. All right, everyone, I'm so excited. I have Erica Harren here with us. She is a BCBA or a Board Certified Behavior Analyst and a mom of a toddler. She's going to be chatting with us today. And well, let's talk about what a BCBA is. They are basically a professional trained in analyzing and changing behavior. And we're going to be talking about sleep today, helping toddlers sleep. And sleep is behavior. So Erica, thank you so much for being here. I'm so excited to chat with you.
Yeah, thank you for having me.
Where are you located?
Austin, Texas.
Awesome. Thank you for making the time to chat with us up here in Spokane. Our audience is located all over the US. We even have some people all over the world. So super excited.
Cool.
Yeah.
I'm excited to be here today.
So Erica, first question for you, what led you to focus on toddler sleep difficulties?
So addressing sleep has been part of my job in older kids with the clients that I've worked with. A lot of people don't probably know this, but typically a BCBA will work with kids with autism. And so I've been doing in-home therapy with kids with autism for about a decade. And so that was something that I've always done a little bit. And then my son was born and didn't sleep. Takes after my husband. And so my husband and I ended up taking a course on infant sleep, which is not something I knew anything about, but found really interesting. And I took an online course format with Taking Care of Babies is the name of the course that I did. And what I really liked is that it was quick, it was to the point, and it was on video. So my husband and I could get on the same page, AKA I could force him to watch it with me. So he had to be on the same page. And I was like, this is just really so much better than like reading a book. And I had the thought, so many of my friends with older kids struggle with this with their kids. And, I know a lot about what to do with the kids that are older with sleep problems. So it just kind of got the wheels turning. And I was like, I love sleep. I'm passionate about sleep. I found it really interesting too. And I kind of just started also studying it on my own and taking some continuing education courses in it. And found that I really enjoyed, helping people get the results that they wanted with sleep.
Cool. So it sounds like you work with kids with autism with sleep difficulties, and we know that is actually a big symptom. Like whenever I'm diagnosing autism spectrum disorder, whenever a parent tells me that their kid has difficulty with sleep, that's a little light for me, telling me to still consider ASD. And then it also sounds like you're working with parents who have typically developing children who also have sleep difficulties.
Yeah, I kind of started out with the population I was working with kids with autism who often do have sleep challenges. And then, but the methods that I was using, I knew didn't only apply to those kids. That's just who I happened to work with. And so I was like, there are a lot of people out there who don't have the benefit of a therapist coming into their house to teach them how to do this, and maybe don't have the resources and information to, help their kids sleep. And everybody needs sleep. So
yeah, and I really want to just reiterate for everybody out there that toddler sleep difficulties is one of the most common things that parents bring up with me in my practice. It doesn't matter what might be going on. I might just be working with the parent just in therapy and not even seeing the kid, but the parent brings up, oh, like part of my difficulty is I never get any sleep because my kid is sleeping. So
right.
It's so common. You don't even
so
have
common.
Yeah, for sure. So what are the most common sleep difficulties you encounter?
I would say the most common is nighttime wake-ups. There are a lot of bedtime challenges, getting kids to go to bed and fall asleep. And then also really early morning wake-ups.
Yes. Agreed. So how is a child affected during their waking hours whenever they have a sleep difficulty?
So they are affected in a lot of ways, unfortunately. So behaviorally, which was, the first thing that I was looking at when I, was first, the first setting that I was working on sleep was with my clients with autism. And it was so hard to reduce any, challenging behavior or teach them new skills if they were so tired. Not to mention the parents were so tired and, less willing to be trained on these things too. But outside of that, typically developing children as well, they struggle academically, often long-term academically, even if, they start sleeping better later in life. They are more likely to be labeled hyperactive, which we know can be a problem. They're more likely to struggle with emotional regulation. They're more likely to be obese. There are just all kinds of correlations. There are even, strong correlations between the time that a child goes to bed and their obesity later in life. So there really is a lot of reason for the child to get the child sleeping well too.
Yeah, for sure. I know, definitely, I feel like ADHD is like a huge diagnosis parents are concerned about. I'll often have parents come in saying, I think my kid has ADHD. And if sleep is a concern at all, we have to fix that before we can diagnose it.
Yes, exactly.
So essential. Yeah.
Because overtiredness actually in children, in an adult, if you're really tired, you look tired, you look sleeping, you're going to try to nap. A child that is overtired is often the opposite, and they're hyperactive and they maybe present as ADHD. So
a little wired.
Right, exactly.
How does it affect parents when their child has a sleep difficulty?
No, this one I can attest to personally. I definitely, felt the difference when my son started sleeping. I had energy. I was able to be, the fun mom that I wanted to. I was able to enjoy, raising my child instead of just feeling like I was trying to make it to the day ready to go to bed again. It really amazes me how much parents in our country are doing with how little sleep they're getting, because so many parents are struggling with sleep and then going to work and, well, right now, maybe also, schooling their child and raising their child at home. So, a lot of the parents that I've worked with are just so tired and have said, if I could get sleep, I could be, the fun mom or the fun dad that I want to be. And I think that that's important. It's important for parents to enjoy raising their kids too, and be happy doing that. And then of course, just like with kids, there are all other kind of things that affect also adults with sleep deficit. Even a small, cumulative sleep deficit can have huge effects on a parent's cognitive functioning, motor functioning, driving a car. And a lot of parents out there are getting, not enough sleep a lot of days of the week. So.
Right. I really love how you were tying that back to the parents' values and how they're parenting, right? All the parents I work with have like this ideal of what they want to be as a parent, and unfortunately, many times by the time the parent gets to me, it's almost like they've said, "Whatever, that's never going to happen. Give up." But my dream is to really help parents to get to that. And one of the things that I do is, whenever I'm thinking about interventions, is first there's safety, right? Like we want to always address safety concerns first. But the next thing I always think about is, what can we intervene on that gives that parent the resources to support their child? Oftentimes a parent might be coming in because they think, oh, my child needs more social skills, or my child isn't doing well in math, or something like that. But that might actually be the last thing we intervene on, because if the parent is overly tired, let's say, because the child isn't sleeping well, then we need to buffer their resources so they have the energy to then work on that primary concern they're coming in for. And it's amazing, because if we do it that way, it happens so quickly. Whereas if we did it the opposite way and we hit that primary concern first, the parent feels so irritable, right? And the child feels so irritable, we don't make real progress, really. And so absolutely. I love it. I love it so much. Oh my gosh. We're going to talk a little bit more after we're done about some other things. Okay.
Okay. Sounds good.
Okay. as a behaviorist who works with young children myself, I often have parents who say to me a few sessions in, hey, you're changing my behavior. So funny. What percentage of sleep difficulties for toddlers do you think falls into that category of environment training versus biological?
So, as I mentioned before this interview, I'm a little too precise to give a percentage or even guess, because I don't know what the percentage is, but I will say that it's pretty high. Typically, these sleep issues in toddlers are behavioral. They're typically not, naturally bad sleepers. Now, I will say that before you try a behavioral intervention, I would suggest having your child assessed by a pediatrician and making sure that they don't have some things that can inhibit sleep, like restless leg syndrome, asthma, sleep apnea. But typically, it is a behavioral issue.
Yeah.
And then that's good news, because that means that it's something that can be changed.
Yeah, for sure, right? There's so much control there if it's a behavioral thing.
Yes, exactly.
A lot that they can do then.
Exactly. And if you remind yourself, like what we talked about earlier, that it's good for them and you, it's nice to know that there are things that you can do and that you're doing, the right thing by addressing it. So
yeah, for sure. Don't wait, guys.
Yes.
Sleep issues. And toddlers, things can be fixed so quickly. Don't wait.
Right. Yeah.
Okay. How would a parent know they should consider getting behavioral support for their child's sleep issues?
So I would say all kids, all toddlers are going to have bad nights. Toddlers, have dreams and they do get scared, and there are going to be days that they're pushing limits. But if long-term, your child isn't sleeping well, even if your child isn't sleeping well, waking up multiple times in the night, multiple days a week, it doesn't have to be every night, then I would suggest, like I said, talking to your pediatrician and ruling out some of those biological concerns. So for example, if your child is snoring, definitely get them checked out, because that's not actually typical in kids. Coughing is another thing that you'd want to get. If they're like repeatedly coughing in their sleep on a regular basis, that would get something to get checked out for possibly asthma. But if that all looks good and your child still is waking up in the night, then I would say go for it. Get some resources and get started, find something that is going to work for you.
For sure. I have found that oftentimes there's an event that happens in the child's life. Like they had one really bad dream, or something scary happens one day. Like they were in a car wreck or something, not a bad car wreck, even maybe just the mild one. And then that's when the sleep difficulty started. So they might only be going on for 2 or 3 weeks. Would you say that's behavioral?
I would say it has the potential to become behavioral. And I think the hardest thing with sleep with your child is that you always feel like you're walking, this fine line, because you love your child more than anything. And most important is that your child feels loved and that you are there for them when they need to. But there definitely is a tipping point where, your child is not getting up because they truly need support at night. One thing I'll say about a child who has experienced an event like that is that once they can learn that there's nothing to be afraid of at night, things get better from there. Because once there's nothing to be afraid of, they learn there's nothing to be afraid of. Does that make sense?
Yeah. Mm-hmm. Okay. Yeah. Cool. Okay. What's the general process from the moment a parent decides they have a concern to resolution of the concern in your ideal framework when working with sleep issues in toddlers?
So the first thing I personally think is pretty easy, and that's good news. A really good bedtime routine solves so many things, and it's what you always want to start with. And not any bedtime routine is a good bedtime routine, although consistency is probably the most important thing. But a bedtime routine that goes from most active to least active and like moves in the direction of towards your child's bed, not to the bed and then back for a toy and then back to the bedroom. So yeah, a most to least, most active to least active bedtime routine that's always in the same order, very consistent, around the same time, is the first thing. So that is something that I think gives a lot of parents like, okay, I can do this, this first step. And that solves, so sometimes that's all people need actually, is a good bedtime routine. If they're able to leave their toddler or preschooler in their bed after the bedtime routine and leave, if that bedtime routine becomes enough of a cue to put them to bed, that sometimes is all they need. Not always, but it can be. And it's important in every step or in every situation we're addressing.
How long,
next. So go ahead.
sorry, how long do you think it takes for a kid to, I guess, accept that bedtime routine so that they're now going to sleep?
I would say it also depends on how long, they've had other routines, right? Like anytime we're changing behavior, it's like, how long has the opposite been going on, right? So, but I would say, give it a week or so as a general.
I think you just like put hope in so many parents' hearts, right? That like this time next week, your kid could be having an amazing time getting put down for bed, falling asleep, giving you more time in the evening to relax so that you can get to bed at a reasonable hour. This time next week, guys.
Yeah, truly having a really good bedtime routine is life-changing, because it's like the last time that you see your kid each day, right? And you have a choice. Like it can be, generally a pretty easy, like expected process that, is enjoyable because your child's not fighting it, because they know it's the same all the time and they know what to expect. Maybe you even have like routine cards that show them what's next. Or it can be an all-out battle that lasts hours and doesn't give you any time before you go to bed, and maybe even exhausts you too much to do anything if you have any time. So I definitely think everyone should try that if they're not doing it right now.
Absolutely. And then you were going to say a next step. I guess that would the next step would be a more intense form.
Yeah. So if you have a child who's still co-sleeping, for example, and you don't want to be co-sleeping, or you have a child who's still eating at night, then a lot of times a bedtime routine isn't going to fix everything. So you would have to address those two things. A lot of times by the time kids are toddlers, maybe the parents are expecting another child and they're like, okay, we're ready to move the older one to their own bed before the baby gets there and, experiences that as because of the new baby, or they're just, their child's moving a lot at this point at night and just nobody's getting rest. I had one mom tell me like that she's, her husband's back was out because he was like getting kicked at night so severely that he like wasn't, I think it was a combination of like not getting rest and then, getting physically jolted while he was sleeping. And she was like, this should have been my wake up call a long time ago. But, there's all kinds of reasons why people are still doing that, but often at this age, they're ready to move to the next step. So those things usually need to be addressed. And then after that, if their child's still not sleeping, then we look at, what us behavior analysts would call more consequence methods too. So maybe some sleep fading, where the parent is fading their presence out of the room because the child's so used to their presence that they're just not going to be able to do that quickly. Maybe a reward system. Reward systems are great, easy, positive things to try when you have a child with sleep problems. Or what I call the excuse me method, where you're just running out. I'll be right back. I have to do some push-ups and then coming back. Really all just giving your child a chance to fall asleep on their own so that when they wake up in the night, they're not looking for your presence, which was there when they fell asleep.
Right. So the thing I love about all three of those more intense interventions is that they're still very gentle. They're very much, they're respecting the fact that your child is going from their current state. I think a lot of times with sleep difficulties, a lot of the distress is on the parents' end, where they want their child to feel comfortable. They don't want their child to be upset. And so even with these more intense interventions, it's keeping the child in a calm state and gradually adjusting them to a new sleeping situation. And I think that's really important for parents to know, because there are sleep methods out there that don't do that.
Yeah, yeah. And honestly, that's what's nice about working with an older kid who has some ability to understand. You know, you can have a conversation with them and you can get them excited about things about it. You can be like, hey, let's pick out some new bedding or a new nightlight or things like that. So yeah, it doesn't have to be a traumatic process. You know, it's probably going to take a little longer than if you did, you know, for example, cry it out when they were a baby. But you know, a lot of parents whose toddlers are struggling with sleep never did cry it out because it wasn't something they were comfortable with. So they're not going to be comfortable with that when they're older either.
Right. Very good point. Very good point.
Yeah.
All right. What's the biggest piece of advice for new parents out there who want to prevent sleep issues from occurring?
So I would say just try your best to develop good sleep habits, you know, as early as you can. I mentioned earlier that I took some sleep courses by taking care of babies. The newborn sleep class was really helpful to me and my husband because you know, we didn't know anything about babies. And, you know, it just gave us some really simple things like, you know, once a day, try put your baby down for a nap or for sleep while they're drowsy but still awake. You know, that kind of like the same thing that these other interventions that you do when you're older are focusing on, is just learning to fall asleep when the parent isn't present every time.
Right.
And then another thing that I liked about those courses that I took was they kind of talked about helping your child put themselves back to sleep using as little help as possible. So, you know, maybe first you I don't want to give away everything from the course, but at first, you know, you don't run in every time they cry, for example, because some babies cry and then put themselves back to sleep. And you might actually be like inhibiting that process if you go in too soon, which was news for us as like first time, highly responsive parents.
Yeah.
Or it was, you know, it was like, try putting your hand on their chest before actually picking them up, you know, just like as little of your help as they're learning to put themselves back to sleep. But it was in a nice way where, you know, you weren't just leaving your baby to figure it out. You're like, okay, I'm just going to do just enough to help you fall back asleep. So long story short, there are a lot of things. I think a lot of people feel like they only have two options when their kids are babies. And it is that you know, feed them every time that they cry, rock them back to sleep, things like that, or you do cry it out. And that's just really not the case. So.
Right. Yeah. I love that. It kind of reminds me whenever we're doing emotion coaching for young kids, where you're just kind of setting the child up to be successful in that emotion management phase. And so you're just kind of cueing the baby in that regard too, so that the baby can practice those skills. But we're not expecting it to be perfect.
Right. Yeah. It's just like, well, let's see if you can do it. And if not, it always ended with, okay, like we'll pick you up and rock you or feed you, you know, if it got to that, we always would. And so we always felt like we were still meeting his needs, which was important to us, but also we were helping him learn to sleep, and he's a great sleeper now, knock on wood.
Awesome. Okay. Are electronics before bed really that bad?
Have to ask this question, make everybody hate me.
They're not going to hate you. I already know my answer, and I bet our answers are the same. I smile because I want you to reinforce what I say on these videos all the time.
Oh, so many times when I had a kid that, you know, wasn't sleeping, and I would, you know, in my in-home practice, and I would walk into their bedroom and see a big flat screen TV on their wall. I'd be like, okay. So what I'll say is, you know, light from electronics suppresses melatonin, and probably suppresses melatonin, and we need melatonin to fall asleep. And what I will also say is that the handheld type devices that most kids are on these days are probably worse because they're closer to their face, right? So you're not watching a TV with your family on the couch usually anymore. You have a device that's right here. And so that light is right in your face. So there's a ton of research to back up that electronics before bed aren't a good idea. You know, they cause kids to take longer to fall asleep. They decrease the total sleep duration, more waking in the night. You know, they're overall they're not going to help your cause if you're trying to get your child to sleep. That's, I'm not saying never give them screen time. I'm saying cut it off at least a half hour before bed though.
Right.
And don't have electronics in their room.
Right. Absolutely.
Because they just don't have the willpower either, right? Like if a kid has electronics in their room and they wake up in the night, like lots of kids I've known are like, well, let me just like turn on my TV.
Mm-hmm. Absolutely. 100%. And the other, I love everything that you just said. I totally agree with it. And then I love that you also went into willpower. Like we shouldn't expect children, especially young children, or even teenagers. I don't think teenagers have the capacity.
Oh, definitely not.
Yeah, to inhibit, unhealthy choices whenever they're tired, or for some children and teenagers, they don't have that capacity whenever they're not tired. And so, especially whenever they're in their bed at night, to turn off the TV, to turn off their music, to not play with their phone, things like that. But then I also want to go into what some families and people will say is, oh, I need the music playing in order to fall asleep. The research says that even that is bad for sleep. So for your teenagers out there who are saying, my music has to play for me to fall asleep, that's disrupting the quality of their sleep.
Yeah.
And they're going to perform better in school. They're going to be less irritable. They're just going to have a better quality of life if they can practice sleeping with either white noise. Only white noise is shown to benefit sleep. So that's the only noise, or with silence.
Yeah. And I will also say with the little kids, I talked a little bit about, fading your presence out from when they fall back asleep. And, for some little kids, a lot of little kids, if they are like fell asleep to the TV being on and then it shut off and they wake up in the night, like they're almost going to need that back on to fall back asleep. Obviously, we know that's not a healthy sleep habit. And then back to the willpower, like, I am an adult woman who has a hard time staying off my phone at night when I'm tired, right? I physically have to move it out of my room to not be on it too, because it's just so easy. And I mean, so many nights that I shut my phone off, I'm like, I needed that hour of sleep. What was I doing, So we certainly can't expect our kids and our teenagers to have more willpower than us.
For sure. 100%. Okay, what about I need a sip of water, please? I hear this one all the time. That many kids use to delay bedtime. How should parents respond to that?
So I actually have a name for this. It's called a curtain call. So the act is done and just one more. So I think it's a little tougher during times like potty training and things like that. Like I need to use the bathroom, but for the most part, incorporate that in your bedtime routine. Make sure they get some water. Make sure they use the bathroom. Well, if they're still happen to be in diapers, make sure they get some water. Maybe not if they're just learning to use the toilet. But so I for the most part say get that out, so then you can say, oh, you already had some water, I think you're okay. Or another way you can go about it is, give a concrete number of times that they can get out of bed for one thing of their choice after you say goodnight, at the most. But overall, I would recommend trying to not let them, because what they're doing, if they do that repeatedly, is they're delaying their bedtime, and then they're shifting their circadian rhythms. And so what's going to happen is, if this happens on a regular basis, then they're never going to be tired at their bedtime, because they're never falling asleep at that time, and they're always falling asleep later. So
I never thought about that, but that is so true, because oftentimes I have parents who say to me, well, my kid can never fall asleep until 9:30. But whenever we look at the bedtime routine starts at like 8:30, and it's a long, drawn out process.
Yeah.
And that's so helpful for me to help parents to understand that we have to shorten that bedtime routine to, if the kid's bedtime is really at 8:30, then shortening it so without, remove all the kids' delays, so that we just have like a 30-minute bedtime routine.
Yeah, that's actually perfect. Like that's a great ballpark bedtime routine. Doesn't need to be much longer than that.
Yeah. Okay, cool. Okay, this one's long. This is a very long question. Yeah. Okay. I think the trickiest sleep situation I encounter is the toddler who has a highly emotional reaction to waking up in the middle of the night. This seems to be very distressing to parents and often leads parents to feel that any boundary setting isn't addressing the emotional needs of the child. I know this is complex. There are the kids having night terrors, and then there are the kids who had a scary dream once or twice and have now developed a pattern of seeking comfort every time they have a brief awakening. How do you address this dynamic with the parents when they're starting out from this point of view that their child is experiencing significant emotional distress that is being triggered by nothing but possibly horrible nightmares or severe anxiety?
I truly think this is one of the toughest lines to walk as a parent. And it depends, right? Like, there are some kids, like I don't want to give a blanket answer and then have parents of kids that truly are suffering from anxiety at night be like, you're fine, and I heard that you should do this. But I do think, well, so let me back up for a second. So if your child is having night terrors, when your child wakes up from said night terror, doesn't remember them.
Right.
If your child's having a nightmare, then yes, they are going to remember them. So I think I mentioned, go ahead.
What's the difference?
The difference is the stage of sleep that they occur in.
Mm-hmm.
And so the one is, what's the word for it? I'm not going to guess. I can't remember at the moment. But one is not something that they're going to remember. So they might be terrifying for the parent while they're occurring, but then the child's going to wake up, if they wake up from it, and be fine. So the parent wants to be careful that their reaction isn't, causing more, the child probably would have gone back to sleep just fine. Don't have a reaction that is going to scare your child or make your child need you to fall back asleep after something they would have fallen back asleep after. Mm-hmm. With a bad dream, I think I mentioned earlier that helping a child realize that there isn't anything to be afraid of and that they will be just fine at night and helping them be okay at night is just only going to increase that. Because once they realize there's nothing to be afraid of and that they are okay, then that increases the chance that they're going to realize, okay, I was fine last night, I'll be fine tonight too. So there are a lot of things that are suggested to do if your child's having nightmares. I'm not necessarily against them, like monster spray or things like that. But I encourage parents to tell them that not validate isn't the right word, not make their fears seem real. You don't need to be like, oh yes, let's look for the monsters that are definitely in your closet. I think as a parent, you say, there are no monsters here. You have nothing to be afraid of. Your mom and I are right next door and we're keeping you safe all night. That's honest. And it's, not letting them know that there are in fact scary things to be afraid of. So that's one thing, encourage them to feel safe, encourage them to make it through the night. And then one thing that I think is kind of a nice almost trick to see just how scared they are is some kind of reward system, because if they're still scared enough that they really need to get out of their bed and come see you, then they can. But you're encouraging them, if they can, if it is more of a habit than an actual fear at this point, then a highly motivating reward system is going to give them pause about getting out of bed, right? If they really want to earn a reward in the morning, then they're going to be more likely to stay in bed. So I guess, long story short, again, one of the first things that I would try is implement some kind of reward system if you're trying to tease out the difference there.
Yeah. Okay. Yeah. And what I've heard about night terrors is the child won't wake up from it. But exactly what you said, whenever the next morning, whenever you talk to the child about it, they won't have a clue what you're talking about.
Yeah.
And yeah, I think parents, you can rest assured that your child is not being scarred by that.
No.
Not at all. Exactly what Erica is saying. It's a different phase of sleep, and your brain has these dreams every single night, all night long. And so it's just that you've got to witness it.
And they are terrifying. I've seen them. They are terrifying.
Yeah. And what would you say to a parent who has witnessed a night terror? And because I feel like, nightmares are different. There's that whole, I love how you responded to the whole behavioral approach to nightmares about giving them comfort and making sure that we're creating a safe space in their bedroom and reinforcement for relaxing and staying in bed. What do you say to the parent whose kid has a night terror? and the parent's distressed?
Well, I would say, think about how you would feel if you were asleep and someone woke you up and is looking at you wide-eyed in terror. So there's no reason to do that to your child. So make sure they're safe. If they're, moving around a ton, make sure they're, there's a pillow to block their head, things like that. But, and if they're out of bed and happen to be like moving around the room, maybe gently guide them back into bed. But for the most part, just let them happen and know that they, for some kids, are a normal part of development. But I will say that they are more common in kids with disrupted sleep or poor sleep. So again, addressing all of these sleep issues is only going to increase the possibility that you're going to reduce the night terrors. So
right. That's the standard form of treatment for night terrors is improved sleep, guys. So everything that Erica's saying, you really want to look into. And of course, we always want to do a disclaimer that if your child is experiencing night terrors, or you guys have any kind of, more extreme nighttime behaviors going on, everything Erica said, the snoring or anything like that, then make sure you go to your child's pediatrician and get some referrals, get your kid checked out first, all of that kind of stuff, so that you can make sure that everything's going okay. But Erica, you have actually some online content, right, to help parents out?
I do have a website.
Yeah, tell us about it.
It's called positivepracticalparenting.com. I have a blog, although I have just recently decided to switch to videos because I had kind of a light bulb moment where I was like, okay, when I was a really sleep deprived parent, I didn't want to read anything, and I didn't want to have to read it and then regurgitate it for my husband who wasn't going to read it. So I switched to video format last week because that's what I wanted when I was a tired parent, was quick, someone just talking at me while I laid in my bed. And so I haven't uploaded my video from last week, but I will be switching from a blog to video format.
That's awesome. I've noticed whenever I take the time to look at the data for my video series, that I have a lot of parents watching my videos at wonky hours of the night. Usually, like super early in the morning. So I'm sitting there thinking like, oh, this parent gets up really early in the morning to do like all the things they have to do before their kid's awake, or their kid is waking them up. One or the other. Yeah.
And the nice thing about video, right, is that you can be doing other things while you're listening to the video too. So
yes, awesome. I love it so much. Okay, cool. Did you say that you're creating a course, or you have a course?
I am creating a course. I would love to create a course that is really similar to what I took when I was learning about infant sleep. Like I said, I love that it was short. It was to the point. It came with, a PDF of data sheets and relevant information that I could pull up in the night if I needed to. But that part of watching it with my husband was huge because he wasn't going to read a book, and it was much easier. I wasn't going to read a book either at that point, to be honest. It was so easy to just like lay in bed and be like, okay, we're going to get on the same page about this and figure out what we can do. And so that's my plan. So I'm creating an online course that is essentially a roadmap of how to get your child from not sleeping to sleeping. So
guys, you should definitely go to Erica's website, sign up for her email list so that you know whenever the course is coming out. Love it, love it, love it. Thank you so much for being here.
Thank you for having me.
Yeah. All right, guys, make sure you go to enildaclinic.com/learning so you can sign up for these learning videos. I am continuing to have experts about all different kinds of topics related to early child development, related to children with special needs, and especially related to parenting. You can also subscribe on youtube.com. All right, guys, see you next time.